Hi, everyone, and welcome to Confronting Stigma in Bipolar Disorder. I'm Dr. Sacha McBain, a clinical psychologist and assistant professor at the University of Arkansas for Medical Sciences.
And I'm Margaret Crane. I'm a clinical psychology PhD student at Temple University.
And in today's talk, Margaret and I are going to be talking about how to confront stigma in your daily life and in the context of your relationships with others. There are lots of different types of stigma, which Margaret will review in just a moment. But because this topic is so big, we decided that we wanted to focus on concrete skills that you can adopt in your life to address stigma as it arises. The International Bipolar Foundation has lots of great talks on their website that address other areas of stigma if you're interested in learning more. Margaret, should we get started?
Let's do this. All right, so we're here to talk about stigma because it causes a lot of problems for people with stigmatized conditions. In addition to distress, it can also interfere with seeking treatment and getting peer support. So as we go through these slides, think about how these messages might resonate with you and the experiences that you've had. Stigma, unfortunately, is quite common, so much so that researchers have even defined different types of stigma. And these different types might speak to the various ways you've noticed stigma come up. And it also speaks to the fact that there's many places where we can intervene to reduce stigma. The first type I want to talk about is public stigma. And this involves negative stereotypes about someone. And it really sets the context for all the other types of stigma. So this might include things like how bipolar disorder is portrayed in the media. That said, it can also be positive associations. For example, for manic symptoms, especially hypomania, some people might view it as a sign of being productive rather than a warning sign of more severe symptoms ahead. Structural stigma is another type, and this involves structural discrimination, which happens when attitudes from public stigma get transformed into policy. So for example, mental health not being funded as well as physical health problems is an example of structural stigma. Family stigma is another type that maybe has come up. And this involves when family members feel stigma based off of association with a loved one. And sometimes this kind of stigma is the reason why family members might not be as supporting as you might expect when you talk about things about bipolar disorder. Self-stigma is the type that maybe you felt. It's internalized public stigma, when people have negative views about themselves based off of that public stigma. In this talk, we're going to be focusing on how to address and respond to stigma in daily lives. And we want to acknowledge that it's really not the role of a person with a stigmatized identity to change all of these different things. If the system were changed, an individual wouldn't need to have all these strategies we're going to go over. We see organizational changes and reductions in public stigma as the long-term game. So in the meantime, let's discuss some strategies that can help individuals navigate the systems that they're currently in.
When confronted by stigma in your daily life or relationships, for example, a friend or coworker says, "She's so bipolar," to describe another person or to describe you, we can at times be unsure of how to respond, so we don't say anything at all. And this can lead to further self-stigma, distress, or disempowerment over time. By addressing stigma at the individual level, we can feel more empowered and confident in our ability to express our needs, our values, and combat stigma overall. It's important that when we choose to confront stigmatizing behavior, that we first understand what our goal for that interaction is. So in DBT, or dialectical behavior therapy, we break it down into 3 possible objectives. The first is maintaining the relationship. The second is getting a specific result from the interaction. And the third is maintaining our self-respect. Of course, we want to have a little bit of each of these in our interactions with others, but it can be helpful to pick one that might be most important at that moment. And we're going to spend some time reviewing the skills that can help achieve each of these 3 objectives. Let's start with the relationship goal. In this case, someone that you love or care about, or someone that you need to maintain a relationship with, like at a job or school, has done or said something stigmatizing. In this case, we may want to be able to confront the stigma while still focusing on maintaining that relationship with the other person. And so for this, we might choose to use what we call the give skill. And so really, this is all about a demeanor and how you're approaching talking about a stigmatizing interaction. So the first is being gentle. Don't attack, threaten, or express judgment. Be interested, show interest by listening to others without interrupting. Be validating, be outwardly validating of others' thoughts and feelings. And finally, try to maintain an easy attitude. Let's go over an example to see what this might look like.
And as we go through each of these examples, we also want to encourage you to think about an example of how this could apply in your life. And at the end of each of these examples, we'll have a second to pause and you can try it out yourself. So in this example, someone said, she's so bipolar. So how could you respond using the give skill? You might say, she's so bipolar. What do you mean by that? Yeah, it's become such a habit to use that term to describe someone. It can be harmful to people who have a bipolar diagnosis, who have to fight against those stereotypes. Can we use something else next time? So in this example, the opening was really gentle and showed interest. It asked them, what do you mean by that? It asked for more information. And then there'd be a pause and that person could then listen to that information. And then the next part, it validated how the other person was using the term. Maybe other people don't know about this yet, or this is something I hadn't learned before. And then it gently shares information and asks someone to do something different next time. So if you'd like to take a moment and pause the video and try writing this out for yourself, feel free to go ahead. And if you did just pause the video, great job giving it a try. It's hard to respond in these ways. And so it's awesome you took the time to practice. And if you didn't right now, feel free to come back later if you'd like to give it a try.
Sometimes it isn't the relationship that is the most important, but the actual result from the interaction. So in other words, we're hoping to see something change and we're working to negotiate that change in behavior with the other person. In this case, you might consider using a skill that we call Dear Man to express the impact of the stigmatizing experience and what you would like to see be done differently in the future. So when we're using Dear Man, we first want to describe the situation objectively, stick to the facts, express, tell others how you feel, assert, say what you need to say, reinforce. So reward that positive response if there is one, and reinforce why that desired outcome is positive. And then as we're doing that, we can kind of think about really trying to stay as mindful as we can, sticking to the purpose of the interaction, not letting yourself get sidestepped or distracted, appearing confident, and finally, negotiation, being open to negotiate or come to a middle ground.
Again, let's look at an example of how we could use this. And as I go through this, feel free to think about an example in your life and how you could use this to tailor it to what's come up for you. So here's the example. When you use the term bipolar to negatively describe Mia, I felt sad and confused because that language is stigmatizing. This first part is an example of the D and the E. The situation was described objectively, and this person expressed to others how they felt about that situation. All right, to keep going, I'd feel more comfortable if we use more objective terms to describe someone's behavior. That's asserting what you'd like to see change. And then by reinforcing the behavior, the example here is, I really like spending time with you, and trying to use less of that kind of language would be really meaningful for me. Thanks for listening. So it kind of described what would happen if they changed their behavior, and then also thank them for trying. That reinforces that effort. And then the man part of this is a little bit more about how to approach the situation. So in this example, the person was mindful. They stuck to the purpose and really just stuck to the fact of, the comment about she's so bipolar. They appeared confident, it was very straightforward. And then negotiate, that last part of the acronym. We didn't really see this here, but it usually comes up in how you'd respond.
Margaret, can you talk a little bit like how you would handle it if somebody does push back?
Yeah, this is tricky. And I think sometimes it's hard to know that in the moment, which is one reason we're also talking through it ahead of time. So for here, a negotiation could look like something like, would you be willing to think about it rather than having them say yes right away and agreeing to change their language? Oftentimes people do need to think. And so rather than just saying yes or no, or maybe they're pushing back a little bit, just saying, could you think about this a little bit more? Because then maybe later they'll come back. However, other times negotiation might not make sense. And so that's when we can use a different goal. So again, if you'd like to pause the video and practice, feel free to do so now. And we're going to move on to our next skill.
So our final skill focuses on the goal of self-respect. Sometimes it becomes clear that while we may not see a different result, we still want to express our needs and values to protect our self-respect. So in this case, our primary focus is on expressing that a boundary has been crossed and leaving the interaction knowing that we said what we felt is right, regardless of the outcome. So for this, we use FAST. F is for fair, to be fair to yourself and others. Apologies, being mindful of not over apologizing for a boundary that's been crossed or for a perspective you might have. Sticking to those values, stand up for what you truly believe in. And finally, being truthful, avoid dishonesty such as exaggerating, acting helpless, or lying.
So to give an example of this, a response where one's focusing on self-respect could be, I know it's common to use bipolar like that, but it's actually pretty stigmatizing and hurtful. Can we try to use more objective language to describe someone's actions? So again, this is a lot about how the approach was. This statement was fair and straightforward, sticking to the facts. This person did not over apologize, actually didn't apologize at all for what they were saying, because that wasn't necessary here. They stuck to the value of letting them know it's harmful and leaving it at that, and it was truthful. There were no exaggerations. So in contrast to the first example with the relationship, this one is much more to the point and a little bit less back and forth. And so at this point, based off how the person responds, you could pull in some of those other skills we've just talked about if you want to engage them in a discussion. And once again, feel free to pause this video if you'd like to give this a try here. We want to take a moment now to talk about self-disclosure, because self-disclosures can come up in these conversations sometimes. And oftentimes in the moment, people can feel a little bit flustered and unsure about what they want to do. And so as I talk through this again, consider a time where maybe you wanted to self-disclose or thought you might, but decided not to. And think about this example as we go through these skills here. So going into conversation with self-disclosure, it can be helpful to have a clear idea and understanding of your values, expectations, boundaries, and goals. And I mention that because sometimes it might not make sense to respond right away. Sometimes that conversation can happen where someone makes a stigmatizing remark, and you may choose to self-disclose in a different conversation where you've thought through this a little bit. So we like to consider a few different things about self-disclosure. The first is what you're actually saying. And we want to just encourage you to remember that you're in control over how much you tell. Person might ask questions and you don't have to answer them if you don't want to. You really can control how much information you're sharing here. The next thing is when. As I mentioned, it doesn't have to happen right when that situation occurred. Again, sometimes having a little bit of space might calm down emotions and might allow you to respond more calmly. And then the last thing is to whom? You don't need to share things with everyone necessarily. And so thinking about, is this someone you can trust with this information? And is this someone who you think will respond in the way that you're expecting and hoping for? When thinking about your goals, it can also be helpful to consider the costs and benefits of self-disclosure. So there are many benefits. For example, not having to worry about hiding experiences or being open with day-to-day affairs, finding others who express approval, including others maybe with similar experiences, finding people who can provide assistance, promoting a sense of personal power, perhaps acting as a living testimony against stigma too. This said, there unfortunately are costs with self-disclosure. We wish this weren't the case, but because it is, we think it's important to think through. For example, disapproval can come, including things like social ostracism or gossip. Sometimes individuals are discriminated against in employment, housing, or other opportunities. People can find they have increased anxiety about others' perceptions of you, or that they're maybe pitying you after self-disclosure. Future relapses also may be more stressful because of the feeling that others are watching you. And again, there also sometimes is anger from others because you self-disclosed. This doesn't totally make sense always, but people respond in ways that are unexpected. And so again, there are many benefits and there are costs. And so this chart is designed to help you weigh those costs and benefits. So for example, if it's a situation where there are few consequences and many personal benefits, that could be a great time to self-disclose. Some situations are harder to tell, where there maybe are low risk of consequences, but there's few benefits, or vice versa. And this might be a time to self-disclose with caution or think it through a little bit more ahead. And there are other situations, unfortunately, where there may be few benefits and there may be high consequences, and that might not be the best time to self-disclose. And again, we wish that self-disclosure was always met with positive reactions, but because public stigma is still present, we hope that this helps you think through whether or not you want to self-disclose, and if so, how much and when you plan on sharing it.
Even when you use the skills perfectly, or you're engaging in self-disclosure, there can still be an emotional toll when confronting these types of situations. And it's natural for strong or uncomfortable emotions to arise when we've been impacted by stigmatizing behavior. And as humans, we can get really hard on ourselves when we experience emotions, and that can actually lead to more negative emotions that impact our overall mental health. And so when we think about responding to difficult emotions, whenever they might arise, but in this case, when it comes to stigma or in response to trying to determine if you're going to self-disclose, we have a couple of different options. The first is to ignore the emotion, push it away, say that it's fine. I think we all do this in some instances. We can try and get rid of the emotion. We can use alcohol or other substances, other vices. We can avoid the person or places that brought on these stigmatizing feelings. Or we can choose to find a balance and to acknowledge the emotion to ourselves and move on with our valued actions. As we discussed, in some situations, that valued action might mean speaking up, or in others, it might be focusing on your self-care and addressing the need that emotion is expressing. So for example, if you notice a lot of sadness after being confronted by a stigmatizing behavior, maybe that's time to acknowledge that emotion and kind of fill your own cup to address that emotion so you can process it in a more effective way.
We want to take a moment to talk a little bit about treatment options, in part because research has shown that understanding treatment options helps reduce stigma. Medication's an option, so is psychotherapy. And we want to note that we just went through skills from two different psychotherapies. One is dialectical behavior therapy, and the other is acceptance and commitment therapy. And these skills can be really helpful for other things in addition to just managing and coping with stigma. We also want to mention that therapy can be helpful for reducing symptoms of bipolar disorder. This said, it can also be helpful with coping with stigma or finding ways to live a more meaningful life. So finding ways to respond to things that might happen based on bipolar disorder, or even just managing things that have nothing to do with the disorder. Again, the goal with therapy is finding ways to have the most meaningful life that you can. We also want to take a moment here to acknowledge that some people may have experienced harmful interactions with therapy as a result of stigma at the level of the system. And we're sorry if that happened to you. These really situations don't have to be the case. And we recommend trying to find a therapist who specializes in treating individuals with bipolar disorder so they understand different risks of the context and also can use strategies that might be more helpful for you. To learn more about different treatment options, we encourage you to go to the International Bipolar Foundation website. It's linked there at the bottom of the slide. This webpage has a great description of many different treatment options.
We want to end by talking about shining a light on stigma. We hope that you find some of these skills we reviewed today to be helpful in thinking about how to confront stigma. Mental health stigma and stigma related to bipolar disorder is a real problem. And you're not alone in feeling stigma, and it's not your job alone to confront it. By understanding what stigma is, how it shows up in our lives, and how to potentially directly address it as we encounter it, can create more opportunities to process stigmatizing experiences in an adaptive way that doesn't lead to internalized shame. We thank you for joining us today for Confronting Stigma and Bipolar Disorder. Again, please check out the International Bipolar Foundation website at www.ibpf.org for more videos and resources. Thank you.